My name is Leslie Schmidt. I'm 37 years old. I have an awesome husband and 3 beautiful kids. I'm your everyday mom.
So Leslie and I were asleep, and Leslie had woken up complaining of pains in her left arm and her back that were pretty excruciating.
I wasn't really sure what was going on because my youngest had just been born via C-section. So originally I thought that my pain medicine had worn off. Maybe I was sleeping in a weird position. I was feeling pain in my chest, pressure, pain in my spine, like a twisting motion, and tried to sit up and figure out what was going on.
The only way she could get relief was to hunch over the bed. And so obviously she was very panicked, and I was as well. And at that point, we knew we needed to call 911.
I met Leslie when I was on call in the ER, and I'd gotten a call from the ER physician saying, I have a young lady who has some chest discomfort. It's not terribly typical chest discomfort, but there seems something amiss. At that point, the differential diagnosis really is she could either have inflammation around her heart, like pericarditis, or may have something more concerning or severe, like a coronary dissection. She really felt more comfortable after she had been at the hospital. Her pain wasn't as bad, and she felt comfortable going home with plans for very close outpatient follow-up, particularly if her symptoms worsened.
It had been about a week since I had the initial episode and was sitting on the couch feeding the baby when suddenly I felt intense pain in my chest. And it was very similar to the pain I had felt exactly a week before. It was getting very bad. I was feeling the intense pressure in my chest, the twisting of my spine, the breaking feeling of the bone in my left arm, and it was starting to move up into my jaw.
So she was taken urgently to the cardiac catheterization lab, and at that point she was found to have a coronary dissection. A coronary artery has layers of cell lining it, but sometimes you can have a spontaneous tear in one of the layers, or the endothelium, and if you have a spontaneous tear, that's called a dissection. And then the most definitive way of treating that is to put in a stent, so that loose flap essentially gets pushed up against the vessel wall and allows the vessel to continue with blood flow.
I get a phone call letting me know that Leslie had been admitted, and he gave me a scenario that would play out with 2 options. First option would be that they would place these stents in her heart that would allow the blood vessels to perform normally. The second option, if that was not successful, was going to be to have open heart surgery.
And so she had a total of 4 Promis drug-eluting stents placed, and they were placed in what we call a T fashion. So you had a basically branch point of the vessel, and so one vessel went straight and one vessel came off at an angle. So the stents are placed in that kind of fashion. So she had a total of 4 Promis stents.
When I saw Leslie laying there with all the tubes and machines, I couldn't comprehend it, really. This is a young woman. She shouldn't be in ICU. But I was very happy that she was still there and this procedure worked for her. Because as I quickly found out, not many people live through this. And I was very happy. I've known her for a very long time. And I don't know what I would do without her.
It hasn't even been a year since my heart surgery, and I'm feeling really, really good. Just trying to be a good mom and be a good wife, and I live for my kids, and I live for my family and our friends, and cherish every moment, and just really look forward to the future.
To the people of Boston Scientific, I just want to say thank you, thank you, thank you. You gave us our daughter back. She's with her wonderful, beautiful family, the 3 kids and the husband, and we're all so happy, and every day we count our blessings.
I want to thank the employees of Boston Scientific for giving my best friend back to me. I just appreciate everything you've done to help and make this a great life for her and I and her family and the rest of her friends. I can't thank you enough.
We're very grateful that there's a group of people out there that go to work every day with the dedication and commitment to building and making products that help people not only live, but help people, have family and help people thrive, with quality of life. And I don't know how you could thank a group of people more, but we're very grateful. You are my sunshine, my only sunshine.
I would really like to take this opportunity to thank the people at Boston Scientific for making my stents, and they saved me. They made it so that my kids could still have their mom, and my husband could still have his wife, and my parents still have their daughter. I'm very thankful and lucky to be here, and just thank you so much.
Yay!